how are you? Did you know that millions of people around the world currently live with prediabetes and don't even know they have this health condition? The worst part is that since it's a silent condition, people often only find out they've had it when they already have type 2 diabetes, when they're already dealing with a chronic disease. So it's very important to identify prediabetes in order to make changes to your lifestyle and diet and actually reverse this condition, preventing yourself from becoming diabetic. I'm going to tell you here what signs you need to pay attention to. Stick around until the end. You won't want to miss this. Before we start, I want to ask you if you currently have prediabetes or if you've ever been diagnosed with type 2 diabetes. And if you have type 2 diabetes, did you manage to identify it beforehand? Did you do any tests or have any follow-up before? Or did you only find out once you were already diabetic? I'd love to hear about your experience, so let me know in the comments below. When we think about diabetes, most people believe they'll be able to identify prediabetes or diabetes through fasting glucose or fasting blood sugar, where the usual guidelines say it should be up to 99 milligrams per deciliter to be within the recommended range. But there are two indicators we can look at to check if you're at a prediabetes stage. Prediabetes is a metabolic condition that, if you have proper follow-up, physical activity, healthy lifestyle habits, and especially good eating habits, you can reverse this situation and avoid developing type 2 diabetes. So it's very important to know what these indicators are so you can pay attention to them. Let's start talking about this now. It's very important, if you want to assess whether you are in a pre-diabetic state, that you are able to evaluate your postprandial glucose levels, that is, your blood sugar after meals. This will show how your body is managing glucose, carbohydrates, and the nutrients it absorbs, as well as how your insulin secretion is functioning at that moment. So, it's extremely important for you to do some kind of monitoring in this regard. You can do a more specific test, which is the oral glucose tolerance test, where you go to a lab, they give you a liquid to drink, and then you take the test to see how your body reacts. This liquid has a specific proportion of glucose, or if you have a finger prick device, the home glucometer, you can measure it yourself at home after your meal to check. Normally, the standard is for this level to stay up to 139 milligrams per deciliter, and prediabetes in the postprandial state is between 140 and 199 milligrams per deciliter. This is a very important point. This is a very important indicator for us to actually see how the body reacts to food. Of course, fasting glucose is important, but especially seeing how your metabolism is related to food can give us a very interesting overview of prediabetes. This is important because prediabetes is often related to insulin resistance. In other words, in the case of type 2 diabetes, the diabetic or pre-diabetic continues to secrete insulin normally, unlike type 1, where there is an immune attack on the pancreas and it stops producing or drastically reduces insulin production. That's type 1, which is a more immunomodulated diabetes. It's an autoimmune disease. In the case of type 2 diabetes, this does not happen. The pancreas continues to perform its function of producing insulin, but the cells can't properly recognize this insulin. In other words, insulin is circulating, sometimes even in greater amounts in our body, but the cell becomes resistant to it, can't recognize it, and can't make that connection so that glucose can enter as efficiently as possible. That's why this insulin resistance always needs to be evaluated in the case of prediabetes. In type 2 diabetes, it's a very important indicator. Many people want to know what causes this insulin resistance. And this is a multifactorial issue. We know that many dietary and lifestyle factors can cause this. So, one of the things that definitely has a big impact is a sedentary lifestyle. The lack of physical exercise is one of the main culprits because muscles play a very important role in glucose uptake that is not mediated by insulin. This is a very important point. And when they become more inactive, when you exercise little, you burn less glucose and it remains elevated in your bloodstream. That's already one factor. Another factor may be related to the increased consumption of refined carbs, simple sugars, and high glycemic index carbs, because they once again cause a spike in insulin, a spike in glucose in our body, and this creates a fertile ground for overloading our pancreas and developing insulin resistance. Another thing that can be a risk factor is being overweight or obese. Fat cells are cells that release inflammatory components, which can increase this insulin resistance and once again promote all these metabolic issues related to prediabetes or type 2 diabetes. In addition, chronic stress can also impact hormone secretion, the uptake of glucose by the cells, and lack of sleep, once again, can modulate this hormonal response in our body. So, as I mentioned, this issue is multifactorial, and we need to make significant changes in our lifestyle, daily habits, and eating habits as well. Another very important point for you to check is whether you have insulin resistance. So, a test you can use for this is to measure your insulin levels, and you can also request the HOMA-IR, which is an index that specifically checks for insulin resistance. There's also the Quickie test, which can be done. Both are blood tests that will help you assess whether your body is resistant to insulin, because often the amount of insulin is elevated, and that alone is already a warning sign for us. But with the HOMA-IR index, you can determine whether your body is insulin resistant or not. So this is also a very important test if you're unsure whether you have prediabetes. We know that diabetes is a chronic disease and it can cause some complications if it is not well managed and treated. So people who live with diabetes chronically for many years and whose condition is not well controlled can develop circulatory problems, not only macrovascular issues like heart problems, but also microvascular ones such as kidney problems, eye problems, and circulation issues in the extremities of the body. So it is extremely important that we are able to control blood sugar levels. People with diabetes can also develop metabolic syndrome, suffer vascular events, strokes, and other vascular accidents. So diabetes is not just harmful because of high blood sugar, but because of all the complications it can cause. Detecting prediabetes can be very important for your quality of life in the medium and long term. So the sooner you get these tests done, if you have any suspicion, the sooner you can make action plans to address it. As I told you, diet is super important. Eating low glycemic index carbohydrates, plenty of fiber, lots of protein, and plenty of healthy fats helps slow down the absorption of these carbohydrates even more. Including lots of vegetables, greens, and fruits will also help you in this regard. Last but not least, many people ask me if prediabetes has any physical symptoms, any signs that show it's coming. Since it's a very silent condition, the signs and symptoms are very mild and can be mistaken for other issues. One of the most classic signs is acanthosis nigricans, where you have darkening and slightly rougher skin in some folds, usually on the neck, knees, and groin. It can be a sign, but it ends up being a non-specific one. Another sign is weight gain in this area here, the central visceral abdominal region, which is definitely very closely related to insulin resistance. That's already a classic sign. So this is an interesting first point where we should already be on alert, but it's also not specific. And another important point is fatigue, that mild fatigue, that tiredness, because of the difficulty in metabolizing glucose, which ends up being a major energy source for us. Have you ever felt any of these signs or noticed any of these symptoms? Let me know in the comments. Also remember the other things I mentioned that can make prediabetes worse. So it's important that you manage to incorporate regular physical activity. The recommendation is at least 150 minutes per week of moderate physical activity, like walking, cycling, or even some specific workout. Sleep is super important, so getting 7 to 8 hours of good quality sleep per night will help you in this regard. Weight control is also super important. Never for aesthetic reasons, because that's always very personal, but for your health, excess weight can contribute to inflammation, can contribute to metabolic syndrome, which can lead to prediabetes and also type 2 diabetes. Tell me down below if you knew about these tests, if you've ever had them done, if they've ever come back abnormal, and what you did to improve the situation. I would love to see your comment. Remember to like the video because that helps me too, and share it with anyone who might enjoy it or needs it. Let's work together to expand this chain of good because that's what I want here with the channel. See you next time. Bye.